So this short course is made up of 8 modules of 90 minutes. The first part of 4 modules is really understanding the basic principles, about understanding how human beings are naturally kind, and that what we're doing in the context of compassionate communities is making use of this really valuable asset that people have. And we look at the biological consequences of this, which are absolutely profound and at every level of the body. We also look at exploring how these networks of relationships exist and talk about how the power relationships involved in professional care can be an obstacle to really helping people at the level of community. The second part of the course is specifically directed at health professionals, or health and social care professionals, people involved in the delivery of end-of-life care. And this really is about understanding about the clinical consultation, understanding about service delivery, about how we shape our services, and understanding about how we can think very differently in helping to develop communities. And perhaps the easiest example of this is thinking about what happens in the context of bereavement, because grief and loss, support for it is found all around us all the time, and we can all contribute to that. So we can talk about death literacy, which is not just about knowing about what goes on when somebody's dying, but it's actually recognizing personal experiences and seeing that the caring for people who are dying is multifaceted. And we can talk about grief literacy, which is how does everyone help and support people who are experiencing death, dying, loss, and caregiving? Because 1% of the population die, 9 people on average are affected by that death, and that means 10% of the population every year directly experience death, dying, loss, and caregiving. And that means that the other 90% have got a really important role to play in supporting them. So death literacy and grief literacy is absolutely critical. And the practice methods of compassionate communities and compassionate cities help to increase death and grief literacy. And this then becomes part of the duty of palliative care services to engage with and work with the sectors of community and civic life contained in the Compassionate City Charter. So this whole course is really about understanding the basic principles to get you to a point where you can start putting this into practice, both within the clinical setting and also within the service delivery aspect of how you integrate with communities and the civic sector.